Welcome to the Infudyne AmbIT PCA Pain Pump by Summit Medical Products pump tutorial. You have been selected to receive an AmbIT PCA Pain Pump to address the pain you may feel following your surgery. A very thin flexible plastic tube, called a catheter, will be placed near your surgical site to administer a continuous infusion of local anesthetic. This catheter is not placed into an artery or a vein. The anesthetic will numb the area of surgery to provide pain relief for an amount of time determined by your medical team, with the goal of avoiding the use of addictive opioids and moving directly to other non-narcotic pain relief medications, such as acetaminophen, naproxen, aspirin, or ibuprofen. Following your surgery, your pump will be connected to the catheter and also to a bag of local anesthetic. These items are then placed into a small fanny pack that you will take home. Your AmbIT PCA Pain Pump has two buttons, a rectangular button and a round button. The rectangular button starts and pauses the pump. The round button is the bolus button. For certain types of surgery, your medical team may allow for an additional dose of anesthetic to address breakthrough pain. This additional dose is called a bolus. You will be notified if this bolus option has been programmed into your pump. When the round bolus button is pressed, you will hear a continuous whirring sound until the bolus is complete, and your pump will then automatically return to its normal rate of infusion. A bolus lockout time will also be programmed to eliminate the accidental or deliberate overuse of the bolus feature. Upon a bolus completion, an internal clock will count down until the next bolus is allowed. Bolus lockout times are usually 15, 20, or 30 minutes. You will be notified what your lockout time is. When your pump is started, you will hear a reoccurring whirring sound. This sound is normal and indicates that your pump is working properly. During normal operation, the round button will blink green, but will double blink green during a bolus delivery. The number on the screen of your pump will begin at 0 and count up with each cc of anesthetic delivered. Your pump will give an audible beep when it has completed the total programmed volume to be delivered. Standard volumes are usually 400, 500, 600, or 1000 cc's, and your screen will show one of these numbers when you hear this beep. Your pump will also beep when paused. Upon completion of your therapy, turn the bottom battery cap counterclockwise to the off position. Continue rotating the bottom battery cap and pull. Remove the two AA batteries and keep. Replace the bottom battery cap back on the pump. Next, remove the top cassette connected to the tubing by pressing the two side clips. Fill out the provided satisfaction survey and include it with your pump. Place your pump into the pre-addressed and pre-postaged envelope provided. Provide the envelope to your postman or bring it to your local post office. A step-by-step description for returning your pump may also be found on the back of your return envelope. And remember that you are responsible for the return of your pump. Do not leave your pump at your surgeon's office, at an emergency department, or any other facility. Please do not attempt to reprogram your pump. Do not shower with your pump or get it wet. Please keep the pump out of reach of children and pets. Please also be careful not to drop or impact your pump onto hard surfaces. Discard the bag of anesthetic, the cassette, the catheter, and the black fanny pack into a wastebasket. Don't worry if some anesthetic is remaining in the bag, as it is common for hospital pharmacies to overfill these bags. You will receive a welcome letter with further instructions, frequently asked questions, a notice of privacy practices, your patient rights and responsibilities, CDC slip and fall prevention instructions, DME POS standards, a manufacturer product manual, and a patient agreement. Instructions on the easy and painless removal of your catheter may also be included. These items may be provided to you in a folder, via an email, or both. By signing the patient agreement, you agree that you will return the pump as instructed, that you understand Infudyne is responsible for functionality of the AmbIT PCA Pain Pump and the disposable cassette, and you agree to utilize the AmbIT PCA Pain Pump only for the purpose it was prescribed. At any time, you may contact the Infudyne 24-hour patient support line with any questions or issues you may have. Your call will be answered by one of our local trained field representatives. You will find this number listed throughout your materials and in bold print on the back of your pump. On behalf of the entire Infudyne team, we wish you a speedy and pain-free recovery.